Welcome back to the Progressive Rehab and Strength podcast. I'm your host, Dr. Rory Alter, head clinical coach here at Progressive Rehab and Strength, with my lovely co host, as usual, Dr. Alyssa Havison. And we are here today to kind of continue this journey or this story that we're working on right now on the podcast for the beginning of strength training or beginning of barbell training. So, where should someone start if they're an athlete, a personal trainer, or an athlete who wants to get into coaching strength training, or a physical therapist or chiropractor who wants to integrate barbell strength training into their rehabilitation process, even if they're in a clinic where they don't have access to the tools, the traditional tools that we would find appropriate for barbell training. So, barbells and plates. But what we want to do in this episode, so in our last podcast episode, so you can go back to episode number 44, we talked about the program and what that looks like, and some free resources that we've put together at PRS that can really help guide you, whether you're using the barbells or other accessory lifts or other implements like kettlebells or dumbbells or whatever. You can use that free program for literally any person of any ability in any situation. And you can also kind of fine tune that free program by selecting if you've got no consideration, so no injuries, you're not pregnant or postpartum, you're under 50 or over 50, even though 50 is kind of this like arbitrary number. We kind of, for the sake of the free program, had to separate age a little bit just so it can customize a little bit more to your physiology. And then also, if you're rehabilitating anything, so if you've got like injuries or whatnot, you can also pick, if you are kind of injury prone, you want to pick that as well, and then it will kind of guide you through the beginner program based on specific elements of your demographic or the person that you're working with. So you can use that free program with people that you're working with or with yourself. But the other side of strength training is not just the programming, but it's also the technique or the way that we move. So years ago, I think it was like 2018 or 2019, I put together a squat manual. And then 5 years later, the lovely Alyssa Havison worked with me to put together the free PRS lifting manual. And we put this together because we have a lot of different areas or avenues through PRS where we teach technique. We have our YouTube channel that has the main barbell lifts, and we'll link all of those in the show notes. We have our podcast where we talk specifically about the main barbell lifts: squat, bench press, deadlift, conventional deadlift, sumo deadlift, and overhead press. And we talk about different issues that people can have with that and how you can maneuver technique to adjust to your body so that you can implement these types of movements without injury or without pain, right? But we have to have a starting point, and we have these different mediums because people learn different ways. Some people can listen and implement, some people need to see and implement, some people want to read and implement, and some people need all of that. So we have all these different areas that you can go to learn about technique, but the lifting manual is something that we are really proud of, that we think you should all go ahead and download. So we're going to talk a little bit about barbell technique, why it's important, which we have a whole episode on, so we'll link to that as well in the show notes. But Alyssa, why don't you tell us a little bit about what we help people understand through this lifting manual and why it's important for novice athletes, coaches, and clinicians to have either this lifting manual or some other manual that has a model by which we're moving.
Yeah, so there's a lot out there on, how to perform a lift, and some of it is good, some of it's not great. And it really depends on where you're getting your information from, right? So, you know, regardless of where you get that information from, there has to be a starting point. If you're going into the gym or if you're teaching a lift for the first time, it's like, where do you start? A squat, your feet are on the floor and you're bending your knees and coming down and standing back up. But like, what else? What else is going on there? And, so having a model, a movement model, which is a starting point to base someone else's movement off of, whether it's yours or a client's or a patient's, is really important. And, like you were saying, Rory, it doesn't have to be our model. It could be any model, but there should be a model. There should be like a why. There should be a here's
Mhm.
where we start and here's where we end up for each person. And the thing that's
Right.
really, 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 really important that for
I
everybody to
think
keep in
she means it's
mind.
really, really important. I've never heard
Yeah.
you use that many reallys.
It's like the most important part of this, in my
Right.
opinion, like to keep in mind is that this is a movement model. This might not be how everybody moves.
Right.
So it's really all about being able to take this model and what the principles in which we teach movement and make them work for each individual person. And even if, you don't think it looks perfect per the model, but that's how someone is moving best and that's how someone feels best, like that's okay. That might be what their movement should be, in terms of finding their own technique and their individual technique.
Yeah, this as you're talking about this, it reminds me of this, what's the term? Debate out there. It's like, can you look at someone, assess their joints and their muscle length and their range of motion and all this stuff, and do you need to before you put them under the barbell? And will that dictate if you do all these like special assessment things? And we'll talk like something similar to the functional movement screening. FMS, is it functional movement screen? I don't even know because I don't care about it, right? FMS, that's all. But and then other people will assess someone's hips to determine their stance in the squat, and they might use the FMS to say, oh, like this person needs to do these exercises before they can even squat with the barbell, right? And in reality, the lift itself is the assessment, right? And we don't need to know where the person is going to end up with their stance, their grip width, their back angle. We don't need to know that before they start lifting. If we have one way, and like we said already, it doesn't matter what way, but if we have one standard way that we start a movement in terms of stance, grip, body position, execution, etc., then we can put that's our assessment because we put the person in that position to do the thing. We see how they do the thing. We use our language and our coaching skills to see if we can improve their execution of it. And then if we've tried everything or they're having pain or discomfort that's holding them back from performing the movement according to the optimal model that we believe is, we as in you or me or someone else believe is these different models that we might be using, then we can say, okay, let's make an adjustment. But we don't need to spend 30 minutes doing an FMS. We don't need to assess someone's hip or knee or ankle mobility or shoulder mobility or whatever before actually trying to lift. Can we do like a short little assessment while they're warming up? Sure, I do that with my clients. But I don't put them on the table and specifically do something. I don't give them specific exercises and like measure it and blah, blah, blah. I just get a sense of, do they take direction, verbal instruction well? Can they balance? And how is their mobility based on them doing like these quick dynamic warm-ups that I'm giving them? And then that gives me a little bit of a sense of what I should expect. But this doesn't happen. Like, I've been doing this for how many years? 10, 12 years. It comes through practice of doing like using the model. It doesn't happen automatically, and you don't make these assumptions until you see it a lot. You look like you're going to say something.
Well, yeah, I'm just thinking because there are these like the FMS and the screening, and you could spend a half an hour putting somebody through all of these tests, determine that they don't perform them adequately, and that they need to get better at them before squatting, and never put them under a bar to see that they squat just fine.
Right.
you know,
Yes.
like they don't need to get better at doing something else in order to do another squat necessarily. And if there are issues, if there really are true movement limitations
You'll
or
see it in the
or
squat.
asymmetries, you'll see it, and you can address them, and you know yeah, we address through cueing and feedback and making changes, but sometimes there are some issues that need to be focused on outside of being under the bar. It's not That's not all of the time. It's like
Mhm.
usually pretty infrequent. But we don't have to do it the other way around. We can
Mhm.
see them, address them while they're still continuing to train.
Yeah.
Um,
So it's interesting to kind of tie it back to the lifting manual and the if they have issues performing the lift, then maybe we need to do other things, right? So, with this lifting manual, essentially it has the squat, bench press, conventional deadlift, sumo deadlift, and overhead press. And with all of them, we talk about bar placement, eye gaze, back angle, hip starting position, end position, grip width, stance, and all that kind of stuff. Now, let's say someone is unable to perform the squat or the deadlift or whatnot with the 40 standard 45-pound barbell because of either weakness or fear, or maybe they could use a 33-pound barbell but you don't have it, or they need a 15-pound and you don't have it, right? The stance and the grip width and the movement execution and the eye gaze can carry over to the other movements that you might do. So if you're going to put let's the squat is obviously like always the example that basically like 99% of the population defaults to. So we're just
it's the
talking about
first
the squat.
lift.
It's the first lift. So we're except for today, I felt so much better by doing the bench press, but that was like a mental thing. I did the bench press first today, but that's because I didn't want to go into the gym. So I was like, you know what? I can bench press instead of squat first and I'll feel better about it because I just didn't want to squat. So then I benched and I was like, oh, this is fine. And then I squatted and it was all good. But anyway, so sometimes we don't squat first, but
In
um
competition, it's always
it's
first.
in competition, it's always first. In the
You can't change.
manual, it's
You
first.
can't change the order when you get
You
to a
can't
meet.
change it in competition, but in the manual, it's first. In competition, it's first, and in most books, it's first. And anyway, so let's say you're doing the leg press in place of the squat. You're still going to take the same stance that we talk about in the lifting manual. If you're going to do a box squat, it's still going to be the same stance. If you're going to do a belt squat, it's still going to be the same stance, every single variation that you might think of, a goblet squat, a front squat, whatever, you're going to take the same stance that we're teaching in the lifting manual. And then same thing for, let's say, bench press. If we don't have the right implement available for the person, so they're a little too weak for the 45-pound barbell, but we don't have a 33 or 15-pound, and we don't have access to dumbbells, where we can do incline push-ups, and we're still going to take the same grip width, right? So um, these things, and same thing with the deadlift. We're going to talk about the stance in the deadlift and where the bar goes. So let's say we're doing a kettlebell deadlift instead of a barbell deadlift, same stance. The dumbbell or the kettlebell is going to be over the middle of the foot, so we're going to place it not in front of the toes but between the feet, for the execution of the lift. So um, all these principles, even though the lifting manual uses the barbell, the stance and the grip width and all those other things, you're going to carry over as much as possible to the next best movement that you can do. Does that make sense?
Well, yeah, and I think that the thing that I love about how we teach the lifts is that it's not about the implement, and it's oftentimes not. simply about body position. It's about all of these other factors. And I like to use deadlift as an example. Where the bar is, the bar should be over your midfoot. I think a lot of people look at a deadlift and think, okay, are the hips too high or too low? But, you know, if we look at where the bar is, shins in contact with the bar, shoulders in front of the bar, we're going to start to see things come together. And that's where someone's deadlift start position should be.
Mhm.
We're not simply looking at where are their hips. In most cases, they'll end up where they're supposed to be. And that's really, how we have to consider that we can take these movement models and make them work for anybody. And not everybody, no one's going to look the same.
Mhm.
No one's going to look like the person next to them. We're not looking for this one like perfect look of a lift. It's all about, you know, physics and gravity and the
Right.
forces.
Yeah. Yeah. No, I think that's really important because two people, like for you and I, for example, we have literally the opposite bodies. I have short torso, long legs, long arms. You have a long torso, short legs, and short arms. And we look totally different when we lift, yet physically, we are executing them the same way because we're following the same rules and moving with the barbell in space according to the laws of gravity and physics, right?
So I
What?
have a question for you,
Yeah,
right?
okay, go ahead.
What about when someone can perform the lift, but isn't really able to maintain or work within the rules or the principles that we want the lifts to fit into for them?
Give me a little bit more of an example.
So, what about somebody who can squat, but they have trouble getting the bar in, the ideal low bar
Yeah.
position, and as they squat, the bar is coming in front of their midfoot, but they're still squatting. Is that okay?
Yeah, I mean, listen, so my favorite saying is everything is adaptable, but not everything is optimal, right? So if we can't get the bar in the optimal position and we tend to have a more forward bar path, we want to check all the boxes and make sure that everything else is good too. Are we unlocking and locking the hips and knees or the joints at the same time? Are we moving in a straight bar path, not necessarily a straight vertical bar, and we want to make sure our feet stay in contact with the floor. We want to make sure that we maintain our tension, our rigidity, all this stuff, and in combination with the program being monitored and progressed appropriate and adjusted appropriately when needed. But if we have to like move the bar up or change the bar position, we need to identify that first and then also change the eye gaze, you know? So, but that's like, even if we change the eye gaze, it doesn't necessarily mean that someone's going to be able to execute with like a perfectly vertical bar path over the middle of the foot because they might. And we have I have one client, and you'll know who I'm referring to when I mention this next thing, that you made comments on his lift in our Secret Society of Barbell Mastery, and I was like, oh, don't worry, Alyssa, like,
I
everything is adaptable, but not everything is optimal.
I didn't know it was your
I know,
client.
I know. So this particular person, and this kind of, will let it slide when it's more related to this person experiences symptoms if they try to do it in the most optimal way, right? So like I said, everything is adaptable, but not everything is optimal. So this particular person had a low bar but was executing high bar mechanics. So that put his bar a little bit forward of the midfoot at the bottom position of the squat, which is fine for him because we monitor the program, we make adjustments, his RPE isn't too high, and all like his joint timing, his segment timing, and his feet were flat, and his bar path was straight even though it wasn't perfectly vertical. So at the end of the day, that's what worked for him. But we wouldn't have gotten there if we didn't have a model for a starting point.
Yeah, and there's always that trial and error to
Mhm.
see, especially when someone's having symptoms, how do they move best, look best, and feel best because we can look at somebody and say, "Oh, that looks perfect," and they could be in
Right.
excruciating pain. Like that
Exactly.
could exist.
Yeah, and going back to that person that we're talking about, he had originally come to me because of like severe upper extremity and neck nerve pain when he was squatting. So I had him execute the low bar. I was like, let me just check it with low bar. That's when he was experiencing symptoms. So I was like, let me just check his low bar and see if it like looks correct or like optimal according to our model, right? So I have him execute the low bar. I fix it so it looks more in line with optimal, and he was still having symptoms. So basically what we did was we moved the bar up and did high bar because that was the only way that he could put the bar on his back without getting nerve pain from his neck into his arms. Fine, so we did high bar, and as over time he just started to lower the bar more and more but maintained his high bar position, and he was progressing fine. He was on his linear progression, and there was no injury in sight. There was no like overtraining or non-functional overreaching occurring anywhere, all the things that we monitor. And that free sustainable training, the free sustainable training builder, which you mentioned in the last episode, and the free beginner barbell program will all do that for you. It'll tell you when to make changes because things are that your training fatigue is getting too high and we need to change it. Um, so he was making this minor bar change over time, and I kind of just let it slide, no pun intended, sliding on his back. Bad joke. I'm a mom. I got mom jokes. That's all I'm good at now.
Oh my god.
So anyway, that's what his technique ended up looking like, and that's okay because it's working for him and it's consistent. So we talk about in one of our technique episodes, and probably in our technique article, we talk about consistency in movement, so it should look the same or nearly the same rep to rep. So he does, and his program is managed appropriately, so that's okay. But again, it's like we have to go back to that starting point in order to get to what's perfect for you. And so that's where that lifting manual comes in as a person who's learning the lifts. So if you're someone who, you know, is starting our beginner barbell strength training program and has never barbell trained before, download that lifting manual because it'll go along with our YouTube videos on the lifts. It will go along with our podcasts on the lifts as well. And you'll have really good visuals and written explanations of the lifts as well, and like the step-by-step process for going through those lifts, and you can bring your little manual with you to the gym or practice in your house or whatever you want. Now if you're a personal trainer, the same thing, or you want to become a strength coach utilizing barbells, like that's where we want you to go. Watch our YouTube videos, listen to our podcast, download our PRS lifting manual, and same thing for the clinician, because in the clinic especially, okay, so you don't have a barbell, but you've got dumbbells and you have a plinth or whatever to execute box squats. You need to, have a starting point for where to put people in space and also how to talk to them. If you have a step-by-step process for executing all the lifts, this goes for coaches as well, then you're going to be a more clear speaker when you're teaching. So to have a process and a step-by-step kind of list of what to do and like what to go through and how to go through it, that'll help you speak clearer, more concisely. And then because you're speaking clearer and more concisely, the person will execute better than if you were like, move your foot here. Well, what does here mean? Give me a reference point, so they'll implement movement quicker and better than if you don't have the language to do it. So the
And,
PR, yeah.
developing that language just takes practice. If you're new to this and you download the lifting manual, you're not going to memorize it and perfect it. It just takes time and experience and working with people and explaining things in different ways to different people because not
Mhm.
everybody receives things or understands things the same way. Where you mentioned something about consistency, which is when it comes to how we're moving, that is the real like, really the most one of the most important pieces of it is that all like, every rep looks the same and they're consistent, but, the thing I wanted to say is that you're not really gonna have that at first as you're learning technique. So if you're a coach or if you are lifting and you're new to lifting, don't be thrown off if every rep looks and feels different because it probably will. And, as a coach personally, when I see somebody going through that, especially at first, I'm usually just quiet. Like I let them,
Mhm.
I let
Yeah.
people work through the awkwardness of figuring out how
Yeah.
it's going to feel from rep to rep. But that doesn't mean that someone needs to perfect technique before adding weight to the bar. We did talk about the or what was our last episode?
The beginner barbell strength
Yeah, I
program.
was gonna say that. We did talk about that and uh on the last episode. And if if you're starting off at an appropriate weight, which should
Mhm.
be relatively light, you're not really risking injury or anything like that. We should be starting light. We're not starting heavy. We're not testing 1 RMs before we know how to perform the lift in order to figure out where to start. It should be light and gradually adding even a little bit of weight every session while still working on technique will help you or your client get better at learning the lift, fine tuning their technique, and ultimately being able to progress more. So we don't really, it's not usually a situation where we're repeating weight all the time to get things perfect before moving up. There are some scenarios where that might be appropriate, but generally speaking,
And the beginner barbell training program will tell you when to repeat,
yep.
when to go up. But I
Just
think
follow
no,
the
no,
instructions.
you're right. And I think, I don't think we talked about this in the last episode, but kind of determining those starting lifts, the starting loads. You know, but those starting loads go hand in hand with technical execution. So like we're going to start really light when we start barbell training because we're not good movers yet and because we're still starting trying to figure out what the movement is and how we execute it. And that is one of the most common questions we get from beginners is should I go up in weight if my technique is imperfect? And we always have this conversation in our courses and with our clients and with people using our programs. No, you don't need to hold back on going up if you are if your technique is imperfect because you should be starting at a load that's really really easy and allows you to move imperfectly.
Now, if the weight is too heavy and we're seeing like technique breakdowns or even just someone who hasn't really developed their technique yet and the weight is clearly too heavy, then really we need to take weight off the bar.
Yeah,
But
if the load is so heavy that it doesn't allow you to practice technique, like
yeah, I mean it's hard enough for an experience like for a very experienced lifter to change their technique
mhm,
under a maximum load. Somebody who's new and learning and the weight is hard to drive up,
mhm.
like, it's gonna interfere with how they're moving. But I always say like err on the side of too light.
Yep.
You'll know if it's too light, but it doesn't hurt to start at something that's like not that hard or like feels too light, and then you're just gonna add a little weight next
Yeah.
session.
No,
Um,
I think that's a really good point because it's not just about like are we able to do the movement well and is the load causing us to not be able to do it well, but also when you're learning a lift the first day or the first couple weeks that you're doing something, and this is from a coach perspective or a clinician perspective when you're teaching someone movement or as an athlete when you're learning something, we got a lot of things to think about. There's a lot of instruction being thrown at us, whether we're watching a video, reading a manual, or learning verbally and visually from a coach. There's a lot of things that we're thinking about when we're lifting. Where do my feet go? How do I hold the bar? When do I breathe? Where do I look? What do I move first? Did I go too low? Where is depth? Like, how many reps did I just do? There's a million things that we're thinking about when we're lifting. And one of the things that novice lifters say is like, there's just so many things to think about. Does it ever get easier? Like, I'm confused, right? And I think that yes, it gets so much easier the more you practice. And this is why we don't do many different exercises in the beginning, is because we're focusing on perfecting as possible. We're focusing on perfecting the main barbell movements so that we're not thinking, okay, hands here, feet here, breathe here, eyes here. Like we're not here's my, we're not thinking about all these million things. It's like, okay, I'm going to squat. I'm going to bench, instead of where does everything go? How does everything move? What am I supposed to do? So when we do too many exercises in a program, it doesn't allow people to learn movements well, and perfect movements. And then I forgot there was something else I was going to say. I don't know.
Well, speaking of like where everything goes, I do think that is one of, and it might sound silly, but that is one of the challenges for someone new. It's like, okay, I squatted, now I'm going to bench. Where'd my hands go for bench now? And I see people sort of like question it, but from the beginning, from the time you're setting up for that lift, it's like, okay, now I'm like thinking about something and I'm confused. And is this where they go? At some point, if you're new right now and you're listening to this, you're not going to have to even think about where your
Right.
hands or your feet go.
It's
Like
going to be
it's going to
automatic.
be automatic.
Yeah.
Um, and there was something else that I was going to say, and I
We're
don't
having a lot of
remember
that in this session
what
today.
that was.
You know what that made me think of, when you started talking about the bench after like squatting or whatever. My favorite is when you're teaching someone to overhead press after you've taught them to squat, and they do their first set of overhead press, and then this next time that they go to overhead press, they like get under it like they're squatting, and I'm always like, wait a second, and I start laughing, and they're like, what am I doing? Like, because
Yeah,
it's
because the
similar.
bar's still in the rack.
The bar is still in the same spot that you're going to do the squat from. So like you were just practicing your squat so much and like moving, it's hard to transition from one thing to the next. So,
Um, I remember what I was gonna say.
okay.
I'm gonna
I'm glad
interrupt
you
you.
remember. No, it's okay.
We talk about, erring on the side of too light when you start. There is always, and it depends on the person. It depends how good of a mover they are, how athletic they are, their body size. But there is this one factor that we can't overlook when someone's starting with a barbell, especially, really for everything, but except for deadlift. But I think that this is experienced the most on squat and bench press. It's like you're dealing with balancing this 7 foot long thing. And now that oftentimes gets easier as you gradually add weight to the bar because it's more weight. It's like it's forcing you to stabilize and create more muscle tension to support the bar. But it's not just like, oh, 45 pounds is pretty light. It's 45 pounds, but it's a 7 foot long bar that's on your back. So a lot of times you're going to see like wobbling. And I wouldn't, as a coach, or even if it's you lifting, I would not see that or feel that and say, "Oh no, I shouldn't add weight," because
Hmm.
contrary to popular belief, adding a little bit of weight each session, whether it's 5 or 10 pounds or,
Hmm.
or 2.5, uh, will make that better. That will get better. The
There's a lot of
wobbliness.
things that get better with weight, like butt wink, especially on um, larger males. Um, John, before my husband, before he before he has weight on the bar, he's like full flexion in the bottom of the squat, like full flexion. So, and I'm not going to be like, sorry, you can't add weight, sir, because you're flexing without any weight on the bar. It's actually when he adds weight, then his back has something to contract against, and his hamstring, and then he does much better once he starts adding weight to the bar. So, yeah, adding weight to the bar certainly starts to even things out. Like I love my Doug's wife. Working with Doug's wife right now also. And we use a 15-pound barbell for her. We do incline bench because she doesn't have the range of motion in her shoulders, to do overhead press. So we do, and also like some balance issues. So I don't want to like get around and off the bench so we just do incline bench every session actually. Instead of doing flat bench, instead of doing overhead press, we do incline every session, for various reasons. Uh, but anyway, it's a 15-pound barbell and it's like flies all over the place when we're doing our warm-up sets, but then once we start to add a little bit of weight, then that bar path like evens out and she's a little bit more steady with it. So yeah, great point, Alyssa. Like if things are like all over the place when there's no weight on the bar, sometimes adding weight will actually improve the execution of that lift and things will look a lot better. So, in terms of the lifting manual, everybody should have this lifting manual. There are images in the order in which we would coach it. There's little descriptions for what you should be doing step by step in each lift, and then we have in after each lift we do true strength limitations. So if someone's truly not strong enough to execute the lift with a 45-pound barbell, we talk about that and how to substitute. And if someone has a true range of motion limitation, so for instance, like a true shoulder limitation on the overhead press or the squat, we give you recommendations for how to address that and what alternatives you can do. But again, utilizing the same grip and stance for most of the variations, provided those things don't cause a flare up in symptoms or whatnot.
There's one more thing that I think is worth mentioning.
Mm-hmm.
So, anybody who's downloading and looking at the lifting manual, our recommendations for the model for each lift in terms of, especially when it comes to like hand placement and foot placement and the model position, are really based off of where most people are going to produce the most force.
Yeah.
And so we were looking for optimal force production and also a reduction in injury risk. And
I think that's key
there
because
are, yeah,
optimal force production might not be
be the same for
the same
everybody.
for everyone. Yeah.
So, really reducing the risk of injury. And at the end of the day, everyone is going to perform better in different positions and everybody has different goals. So, whether you're new and you want to get into powerlifting, like competing in powerlifting, or you just want to increase strength and become more active, this is a really good place to start. If you're a coach and you're looking at this and thinking, okay, well, this is where they suggest putting the hands or putting the feet, but I see people in competition with a max, like, with stance for sumo or a max with grip for bench. Those things often, like in some instances, they may have a place for someone who wants to potentially bench more weight if that is appropriate. But we always do want to include some other form of strengthening through a greater range of motion. And also, these like I said, these positions are a model. They're a
Mm-hmm.
starting point. Some people are going to do better with a narrower or a wider grip or stance. But at the end of the day, we want to reduce the risk of injury for everyone so that you can keep lifting and
Mm-hmm.
keep lifting safely and feel good and get stronger over
Yeah, we
time.
have I believe we have an article and a podcast on the 9 elements of safe and effective barbell training which dictate our technique. So
We do.
we
That
do.
is correct.
So I'll link those in the show notes. So everything that we suggest in terms of the execution of the model is based off of those 9 elements. But then you can adjust the model or the position that the person is in by keeping those elements in mind. And we want to just check off as many as possible. Not everything has to be perfect, not everything has to be executed of those 9 elements, but the more of those 9 elements that we satisfy with the person's execution and technique of the lift, the better the person will better chance the person will lift a lot of weight while staying injury free as long as possible. But again, in combination with the program, because we cannot forget that the program is part of the process as well. So let's go download the PRS lifting manual and check out all those links in the show notes. If you've got any questions on your technique or your client's technique or how to change and implement for someone that you're working with, you can join us in our free Secret Society of Barbell Mastery on Facebook. It's a group that we do free form checks, we do Q&A sessions, and we would love to have you in there. So check that out, and we will talk to you in the next episode. Bye for now.